Alright, so I have the Respironics P60. It's already on. It's not hooked up to any oxygen or anything. So the settings for ST mode, go click that. Activate that real quick. And then, so it needs a 15/5, which is already set. IPAP's 15. EPAP is 5. Respiratory rate is set at 16. O2 needs to be set at 60, which it already is. You need to adjust it for an ABG of 7.32, which is the pH is 7.32, so their alkalosis, their PaCO2 is 66, so it's respiratory alkalosis. So you would want to decrease the tidal volume, which would, for this instance, you want to decrease it, help bring that PaCO2 up. So you would want to increase the tidal volume in order for the ABGs to start coming down. So let's see here. And then the tidal volume up here is really high just because it's not hooked up to an actual patient, it's not sealed. So let's see. Oh, we'll set alarms first. So right now it's the rate is 10 breaths per minute. So if they start going apneic, they'll hit 9 breaths per minute, and then it'll sound. And the same with 50. If their rate gets that high, it'll also sound. We have the low tidal volume. We have set at 100 milliliters. So we, if they drop below that, or if there's a leak, or if there's something wrong with it, it'll sound. That way we can come get it fixed. The patient is still having a ventilation. Let's see. So we've got tidal volume set at, or minute volume is set at 3.5 liters per minute. So leave that. And for the EBG, let me see here. That one. Okay. And then for the volume control, this is the only one I can actually get my hands on. So let's see. Here, set a tidal volume of 500. And then it wants a peak of 5. Player 2 of 60, which is already on. Respiratory rate of 16. Increase that down. And then eye time of 0.8. And then the settings should be set, alarms should be set as well, making sure your patient doesn't go apneic, they're not in any respiratory distress, keep monitoring the patient. And then in terms of oral cares, they're intubated, you're going to want to, don't have the actual, let's see. I don't have the any of the swab, the suction kit. I don't have that with me at the moment, and there isn't any spares in their supply closet, at least down here. So what you're going to basically do is, you're going to put gloves on. You're going to use the swab which comes with a sort of solution to basically cleanse the mouth. Keep it also should come. Some do come with a what is it called? Some other solution that will keep the mouth hydrated. That way, it's not dry. They are intubated. Their mouth's gonna be open. You want to basically make sure that their mouth is clean. You clean their teeth real well. That way, it doesn't cause any further problems, any complications that we don't want. And then in terms of cuff cares, you can change the cuffs when they are soiled. However, so you're going to check the cuffs, you're going to look at them, you can check the cuff pressure. There's a way to measure it. You can plug it in and it'll measure what the cuff's at. You can inflate it or deflate it as needed. That way there's no hyperinflation, there's no damage being done. And so you can increase it, that way it's not deflated to a point where it's not benefiting the patient in any sort of way. Cuff cares, you can change the cuff ties, which, be careful not to cut them if you have to. You can accidentally cut the pilot, which causes more complications, which chances are the stuff will need to be changed out. And then, so I got a universal inline MDI adapter, as well as one for a nebulizer. And what you're going to do, let's see if you can see that pretty well. So you can hook up the part that's connected to the patient, and then the other part connected to the vent. And then you can, let's see, this is the neb one. So you're going to take the nebulizer and you're going to plug it right into there, so it's a one-way valve. That way nothing comes out, it's just going straight to the patient. And these treatments do take a little bit longer. However, these pieces are helpful in terms of giving a breathing treatment to a patient that needs nebulized. And same with the inline MDI. It works about the same way. One side connects to the patient, the other side to the vent. This one, let's see if you can see it really well. Kinda. You will place the MDI on there. It kind of fits there, and then some machines should have a mode on there where you can do an inspiratory hold, in which you can, if you time it right, you can spray, do the inspiratory hold, and then let them breathe out like a normal MDI would be, or MDI would do, or any sort of inhaler. And then you're gonna wait that 30 seconds to a minute, allow that to settle in, them to breathe, and then you're gonna do it again. Just put it in there, or keep it in there, and then inspiratory hold, spray, coordination. That way, they're still getting that medicine, and everything turns out just fine. Alright, and I think that's about it. The alarm shut off here. Okay.